Thanks for tuning in to episode 11 of the Between the Lines podcast. This month, IDS researcher Hayley McGregor speaks with Maya Unnithan, Professor of Social and Medical Anthropology at the University of Sussex, about her new book, Fertility, Health and Reproductive Politics, Reimagining Rights in India. Drawing on ethnographic research over the past 18 years, Maya brings together the practices, experiences and discourse on fertility and reproduction in northern India into an overarching analytical framework on power and gender politics.
Maya, I'm interested to hear how this book came about and what was behind it.
Thanks, Hayley. Well, the book has really kind of grown out of research that started in 1998, and with a number of questions that I had in my mind and my thinking back then. So, questions to do with childbearing, conception, and contraception. Processes, often regarded as so universal and taken for granted, but which seemed actually quite challenging in the context of where I was working in Northwest India, in Rajasthan. Yeah, I mean, there were questions, such as, mundane, but, what were the experiences of conception, pregnancy and infertility that women and couples had? And, how were these sort of culturally shaped and challenged by this, fairly harsh economic and environmental conditions in which people lived. And this seemed completely not taken into account of within, the kind of development policies or the literature that was coming out on family planning and sexual and reproductive health. Practical questions, for example, how do you manage your menstruation in a context where, you don't have any water to wash? And issues about, we've been told women don't have, much sort of agency or decision making when it comes to, when to have sex or when to become pregnant. But was that really the case? And, and how actually do couples in these contexts decide about the kinds of contraception that they want to use? Do they have these conversations at all? What kinds of conversations are they having about these issues? And also, how have these conversations changed over time?
So there was always this longitudinal perspective to this work.
Yes. I mean, I think that's one of the real kind of, one of the both, one of the, I think the strengths and things I really, that I really enjoyed, but also one of the challenges of how do you write, over such a long time.
Yes.
But it's within these kinds of conversations that, I then became really interested in conversations about entitlement.
Yeah.
So that is, how senses of sort of reproductive and sexual entitlement and claims of the body, how are these held, how are they expressed, how are they practiced by women and men from, particularly from sort of lower caste and poorer groups, both Hindu and Muslim in Rajasthan. So that's really come out, so this kind of focus on, as it were, reproductive rights has this kind of background in a longer and much more on the ground kind of sense of how people were talking about these issues themselves, and an interest in how they were talking and about these issues.
And that on-the-ground picture, was there not also an interest in linking it to government, sort of prevailing government and discourse?
Yes. No, absolutely, because this, what was happening on the ground and, amongst, these conversations that people were having in families and, in households and so. It actually then led to a much more kind of, I think, sort of dense and layered kind of perspective on thinking about the discourse of reproductive rights. And this was helped actually by the fact that, this research also took place at a time when the Indian government and NGOs were kind of fervently kind of engaging with rights-based approaches to health and development and, sexual and reproductive health rights. So this is, from, say, 2002 onwards.
Yeah, so quite fundamentally, there was always this quite anthropological interest in what was going on the ground, but then also how did this relate to this broader development discourse that was being picked up in government and NGOs. So this is sort of interesting, as you say, very layered perspective.
And I think actually the book engages with this broader institutional discourse on rights that was taking place at the same time, as you say, that it sort of examines these local practices of reproductive entitlement. And it engages particularly with this broader discourse in terms of its focus on development actors. So, civil society members, members of health NGOs and, working across sort of Rajasthan, but also across the country in terms of the network around the People's Health Movement. But also, health providers and how they were engaged in this kind of rights work and rights talk. And so the book is I'm trying to bring out the kind of different ways in which reproductive rights are are understood and imagined at these different levels, by state and civil society on the one hand, and then also, in terms of understandings and perceptions of those who are both subjects and objects of these state policies and NGO interventions.
And then you link that quite particularly to power and structures of power, don't you?
Absolutely, and I think that this focus on power is, again, it's a localized sense of understanding power. So so the book uses reproductive rights and these sort of the talk and the practice around body-based entitlements as a lens on how power is actually experienced and navigated in an everyday context, both amongst families and development actors, you see.
Yes.
And in its kind of broadest sense, I think the lens of reproductive rights is drawn on really to understand sort of gender politics on the ground and, also how it plays out in development practice.
Yeah, and there's sort of intersections between those two levels, if you will. Yeah. As I understand it, you also link your ethnographic analysis then to contemporary Indian health reform and indeed to global discourse in health on rights. Can you just tell us how you do that?
Yes, so the book actually starts with 2 introductory chapters which cover, in a sense, both these, the overarching sort of concepts and frameworks, methods, and that's an introductory chapter. The second chapter is another introductory chapter, which is on the history of state policies and how these have changed around health in India, and then the kind of impact that has on how health programs are organized in state-wise in Rajasthan. So looking both at the sort of national picture and also what does that mean when it shifts? How is it kind of structured at the level of the state, and how does that then sort of provide a framing for actually the health system?
Yes,
and how it works.
Yes.
In the state, and in a way, these 2 chapters, I keep returning to these chapters through the ethnography that I set out in the subsequent chapters in the book. And then towards the end, I actually move more sort of, more globally in terms of, in the epilogue, I actually set out some of the implications of the findings from the ethnographic chapters, but look at it in the context of advocacy work at a more global level, and also in terms of, the quest for evidence by WHO.
So do you bring in some of your own experience there?
Yes, I sort of talk about this in terms of how I was a member of the committee looking into what constitutes evidence in terms of human rights bases in WHO, and I reflect on that in terms of what I've experienced in Rajasthan and what people have been telling me, and the amazing kind of insights people have given me into their lives. So,
yes. And do you reflect on the degree of receptiveness to that perspective, that kind of evidence?
Yes, and it's really interesting because there is a receptiveness, but it's about knowing to what extent does that evident, and to what extent can one actually use that to promote people's own thinking on the ground. And I think one of the really interesting things for me was I felt that I could bring this voice and the story of the people I knew and met in this remote village in Rajasthan right up to the grand portals of the WHO.
It's a rather fitting end to reflect on those two extremes of context. Yeah. Maya, moving on, I'm very interested in the title of the book. We have Fertility, Health and Reproductive Politics, which you've talked about. And then your subtitle is very interesting, Reimagining Rights in India. And I'd like to ask, why reimagining and not just imagining?
Okay, yes. Well, actually, reimagining rights is that subtitle is actually linked to the core argument that I make in the book, which is really to make a case for a more inclusive approach to reproductive rights, which accounts for sort of diverse senses of entitlement and moral claims on the reproductive body. And really, it speaks to the questions really of how and whose rights are to be delivered, and in what way, how are they going to be realized. And really, this is every time it came back to me that the presence of rights upholding kind of institutions and laws do not in themselves deliver rights. They don't deliver reproductive justice.
So the central focus on that was really the core concern on the ground, wasn't it? Justice.
Absolutely. And it is, and as one of the respondents seeking sort of compensation through the family courts for domestic violence told me, they said, well, rights have arrived, rights have come, adhikar aa gaya hai, but justice has not. Nyay has not come. And that really got me thinking about this relationship between rights and justice. Which I think is so important. And it's that link between rights and justice that I think has to be the core focus of development policy and planning. And I really think in this sense, this thinking then on rights-based approaches within global health and legal institutions has to be reimagined in that kind of context.
Yes, no, I exactly. I mean, that is such a strong argument in your work that language, that global discourse of rights doesn't in any way capture these nuanced and sometimes quite different conceptualizations on the ground. And I mean, I guess that advocacy work enables you to try and contribute to some of that reimagining, at least at that WHO level, but also within India in these different institutions. And
yes, indeed.
Which, of course, is all quite challenging. So I wanted to sort of move on and ask a bit about some of the challenges. First of all, in the writing of the book, I imagine there was methodological and conceptual challenges, and I wondered if there were any you might choose to reflect upon now that it's published.
Yes, I think there were two sort of main challenges that I can just think of that immediately come to mind. And one is really about social change and how do you actually capture it. You can write about it, talk about it, but how do you capture this? And I found that in an ethnographic sense, and I found actually that being based at a sort of peri-urban site that is on the margins of the city, so not quite rural and not quite urban in terms of the families that I was going to speak with, where in fact the pace of development is quite fast and rapid. There was a lot of I've worked around Jaipur city, and there was a lot of sort of money being made through agricultural land and other land being sold in these kind of margins to the city. And so the families living there were becoming really kind of quite wealthy very fast. And so how did that have an impact on thinking about entitlements and so that was kind of one thing which actually led to some interesting discoveries, which we can,
so there was a choice of site, and then you also had this period of time, this longitudinal approach, didn't you? I mean, Did you make some methodological choices there?
Well, indeed, I think these sort of the longitudinal and the length of this took over 20 years to and various bits of field work, and I think the importance of that was really, I think, in terms of another question, another challenge which was there for me, which is we talk a lot about intersectionality, and as anthropologists we really work
in that frame.
We work in that frame. But how do you actually do intersectionality? And particularly, intersectionality is not something that exists at one point of time only, that how different things impact or come together. But how can you account for intersectionality over a period of time? And in order to, so this was a real challenge. And I don't know if I've managed, to really do justice to it. But the way I tried to sort of capture some of this sort of complexity was really through telling the life stories of two women whose reproductive journey, from sort of motherhood till grandmotherhood, I was actually a witness to. So when I started the research, they were young mom. They were young and moms. I was a young mom.
Yes.
And I have witnessed them, their children now having children.
Yes.
And
yes.
I'm not there yet.
They've overtaken you.
They've overtaken me.
Which is interesting in its own way.
But so I think that's.
Those
I think, and I'm so and really, I also want to make this point that I am very grateful to them, for enabling me to do this, not only in terms of just a description of their lives and things, but also I feel, in terms of the way they analyzed what was happening. And I think we, as ethnographers and as scholars, we never thank the people we work with for using their analytical models. And I want to thank them for that. I have a lot of this work is really building on, the work of many people, many scholars, many medical anthropologists, many feminists. I talk a lot about feminism in the book as well. But at the end of the day, the analytical models also of the people I worked with, have to be acknowledged. And this actually is also linked to some of the things that emerged as quite interesting and different and challenging, and how I think some of the findings of the book might challenge some standard kind of ways of thinking.
So finally, maybe you can just summarize for us what you see as the main contribution of the book. Why does this book matter? Why should people read this book?
Well, if they read it, I hope they do.
should.
Then I think some of the really interesting things about the book, that are challenged in terms of sort of standard thinking. Firstly, I think sort of just public health ideas around reproductive health. What does what does reproductive health as a concept really mean outside these public health framings and development policy framings, And one of the things that really struck me, very strongly in the discussion around infertility that I had with the women I was working with was that, reproductive health seemed to be regarded very much in terms of ritual purity, as
rather than a biological kind of framing of it.
That's right, and not something that has a medical or physiological. It's not something sort of about physiological well-being as such, and linked to that, therefore, it was not then surprising to find that healers, faith healers, rather than public health officials or providers, were the ones who had a sort of greater conceptual hold over how people thought about reproductive health, but also then influenced their reproductive health seeking behavior. So I think this is something, again, this is going back to the issue about, analytic models, and whose analytic models do we prioritize and privilege. I think so that was something that I think would be interesting for people to read about. I think another issue is about the sort of hidden and implicit maybe biases within state health provision, and how these might work. And this is particularly around the area of surrogacy, how these might work in the form of, having really good quality care. Yes, it can and does exist in India, but it's for particular sort of a particular class, wealthier infertile people, whereas poorer infertile women have absolutely no access to this. There's no thought about raising that standard of quality of care. So even though we have this value now being placed on women's childbearing in India through these amazing sort of national health mission programs and catering to women's rights to their bodies and childbearing, etc., it does not actually translate into value in terms of healthcare provision on the ground.
And it's not prioritized in the same way it's for poor women.
It's not prioritized.
That's very interesting. And I think this leads me to, finally, I'd like to ask, because I think one of your key insights is these different understandings of agency and reproductive agency. And I mean, what I've always loved about your work is how those ethnographic accounts, the ones you offer, really challenge received assumptions about rights and agency. So I wondered if finally you can just encapsulate for us what sort of fresh insights this book brings to reproductive agency.
Well, again, it's through the chapters, and I give many sort of examples of this. But I'd just like to use one example, and this is to do with sex selective abortion. Because, of course, sex-selective abortion has been a major issue in India, and it's also reflected in, the really significant shift in child sex ratio sort of figures and statistics in favor of boys. And Rajasthan is one of the key areas where this is happening. There's been, a lot of state action, a lot of feminist sort of, solidarity in talking about how this leads to gender inequalities. And yet I found there was a very different kind of response to it in the kind of communities I was working with. Both, interestingly, in the health provider communities and in, the families and that I was sort of doing. And here I found that women actually sought out sex-selective services themselves. They were not sort of coerced. They were doing this with different reproductive futures in mind.
With an agency.
With an agency. Those of their daughters. They wanted to prevent them from actually even just being born and being subject to discrimination. And it was this kind of language, and also, that then health providers used that provided these services. It was actually the language of rights. That is, we are supporting the rights of women who want to
have sex-selection abortion.
And prevent their daughters from facing discrimination, So these kinds of ideas really have led me to reevaluate notions of, standard notions of reproductive agency. So that's just sort of, I think, one example.
And that has relevance really far beyond India. So this is really where the book starts to contribute in a very substantial way to anthropology more broadly.
Yes, anthropology more broadly, but, and also there's a lot being done, especially now we're living in a moment of, and the need to refocus on abortion, given the kind of neoliberal times that we're living in. And one of the things, I really want to sort of make this point in the book, that sex-selective abortion also has to be seen in terms of approaches and ideas of abortion more generally. And that abortion on its own can't be looked at without a sense of understanding people's ideas on contraception and other issues. So we cannot have a siloed approach to these issues.
One discourse on abortion that fits everywhere.
That fits everywhere. So I think, this is...
I think that is a substantial contribution, and I think really the book shows how these anthropological perspectives then really can contribute to theory, but also to reframing global health policy and discourse at that level. And I think really your work there and shifting ideas about what kind of evidence counts is a really interesting contribution also beyond these fascinating ethnographic accounts of how these concepts are understood differently. So thank you so much for describing them to
thank you so much for this wonderful opportunity to speak about the book. And I'd also like to thank John Gaventa for kindly inviting me, and to Sarah for organizing it so well. So thanks very much.
Thanks for listening. If you like this, then please subscribe and share. Between the Lines is a monthly podcast published the first Wednesday of every month. It's brought to you by the Institute of Development and Studies. Follow us on Twitter at IDS_UK or visit ids.ac.uk.